Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha from Roots Community Health Center, reporting for the week of April 25th, 2022. After providing a brief pandemic status update, I will provide some updates regarding COVID-19 testing, as well as super spreader events and youth update. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments, by direct message, or by email to admin@rootsclinic.org. Here in Alameda County, taking a look at our 14-day average, and remembering that this is still about 1 week behind, that the 14-day cases are increasing. When we went over this last week, we were at 2,176. Now we're at 2,892. So definitely ticking up in the wrong direction here. Hospitalizations and ICU, unfortunately, also are ticking up in the wrong direction. So we were at 41 and 3 of those in the ICU when I reported last week. We're now at 53 individuals in the hospital with COVID-19, and 6 of those are in the ICU. So that is a fairly significant increase in terms of hospitalizations. And so this is something we're going to be keeping a really close eye on, because as you will recall, cases are becoming less of a reliable indicator simply because so many tests are being done at home. But you will end up, if you need to be hospitalized with COVID-19, you'll end up there with or without having tested in advance. So this is a late indicator, but also a reliable indicator. So something we'll be keeping an eye on. Also, we have seen an increase of 13 deaths now. On the dashboard, we're seeing 1,875 individuals have lost their lives to COVID-19 in Alameda County. And in terms of vaccination, we're not really seeing much of a budge here in terms of those who are fully vaccinated. We're still at 83.7% fully vaccinated. That is still a lot better than the national average, which is at 66%. And actually, Alameda County, along with all of our neighboring Bay Area counties, are in the 80th percentile there. So we are definitely doing better than average, but also seem to be at a bit of a plateau here. And of those who are eligible for a booster, about 63% have received their booster, so still some work to do there. And in terms of our 7-day positivity rate, this is also going in the wrong direction. Pretty substantial increase here from 3% positivity last week, now at 3.9% positivity. Again, this is very dependent on who's deciding to get tested at a place that's going to report to the public health department. So that's pretty much most of the testing sites that are going to be using PCR tests. But this obviously does not include any home tests. Still, don't like to see it going this quickly in this direction. And I'll just briefly show that the East Bay Mud site that's looking at the wastewater sampling hasn't been updated since April 7th, so really delayed here. And I'm definitely hoping that this is something that can be updated more frequently, because I'm hoping that this is something we're going to be able to rely on. But of course, if it's not updated frequently enough, this is going to become less useful. So hopefully by next week, I'll have something to update on wastewater sampling for the East Bay. And when we look at Oakland Unified School District, we see that last week when I reported, we were at 0.8% positivity. Now we're at 1.1% positivity. So also increasing. Wanted to just point out here that you can see that most of this is rapid testing. So this is the antigen testing. So this is different than, having majority PCR, which do become positive sooner. They also stay positive longer. So this should be an indicator of those who are actually infectious, because we're using the rapid antigen test. But I'm going to talk a little bit more about some updates regarding testing shortly here, but just wanted to note that in the schools, the vast majority of the tests are actually rapid antigen tests. So that is presumably different than what we're looking at when we look at the county rates, which are mostly focusing on the PCR, which is much more sensitive and becomes positive much sooner. In terms of variants, we're looking here at the CDC's tracker for variants, and we can see that we've got a new color here, this salmon color, I guess, BA.2.12.1. This is another subvariant of Omicron. So primarily we were looking at the BA.2 subvariant quickly taking over. That's that pink color, but now we've got a new one on the scene, BA.2.12.1, and that one seems to be increasing even faster than BA.2 had been increasing. So far, it looks like it's about the same in terms of severity as BA.2, but it is looking quite a bit more transmissible, and so we do see that seems to be rapidly displacing the BA.2 subvariant. And still some remains to be seen about how our treatments and everything are going to be holding up, but so far from what we can tell, it seems to be about the same in terms of how well it's getting around our vaccines and things like that. Our vaccines are still holding up, so it looks to be about similar to Omicron, where we really are going to be needing those boosters to be mounting a good enough response to protect us from Omicron. And here you can see the map. And so again, the pink color is BA.2, and kind of that more salmon color is the BA.2.12.1. And we can see that just like most everything before this, it's starting kind of on the East Coast and so working its way on over to the West Coast. So we'll continue to watch that. Now, in terms of testing updates, we've sort of been saying that tests are becoming a less reliable indicator because more and more people are doing tests at home. And I've been getting a lot of questions about how reliable are the antigen tests against Omicron and all the subvariants, and do we need to be doing anything differently? Do we need to be doing a throat swab in addition to the nasal swab? There's just been a lot in the media that I wanted to go ahead and do my best to address. And I'll say that I think we don't really have a consensus here about exactly the antigen test, except to say that they are still working with the Omicron. They are still picking up Omicron. Some people are saying they're taking longer to turn positive, and this is just very difficult to really sort out because we've got so many things that are going on at one time. What does seem to be the case is that when you are vaccinated, then you're not going to have as much of a viral burden sort of in the nose. So when you go to take the test, it really is only going to be positive when you have a lot of it there. And this is for the antigen test. And so there are some experts that are saying that the best bet is to do a throat swab first and then take the specimen from the nose. And there's even some countries that are recommending that, but that is not the recommendation here in the United States. And actually, there's still some cautions there because we don't have enough evidence to say that this is the best way to do it. The concern is that if you've drank some soda or some lemonade, that can actually interfere with the test. And so I would say that right now, I don't think we have enough evidence to say that for sure we should be doing the throat first and then the nose, although anecdotally, and there is some evidence from other places that is suggesting that we may be more likely to pick it up sooner this way. So I would say that right now, what we do know is that the tests that we have were tested and validated using the nasal swab, and that we don't want to create a bunch of extra steps or additional confusion. And so I think sticking with just the nasal is a perfectly reasonable approach. However, we're still going to want to repeat the test in order to be sure. So we are hearing people say that their first and second day of symptoms, they may not have had a positive test, but by the third or fourth day, it is turning positive. And so it just seems that each variant may be a little bit unique as far as how much we can expect to be present in the nose. We still think that that is strongly correlated to you being contagious. So if we're still using this as a test to see if we're in the infectious period, that is still reasonable. If we are using it to see if we're ready to come out of isolation, this also could be reasonable. So you are already positive and now you're doing the test to see if you are still contagious, turns negative, then I think that that is still safe to assume. But if we just have to get it right, we're still going to go with the PCR test, and we're still going to err on the side of isolating or quarantining if we were positive or exposed, or if we have symptoms. But I wanted to also point out a couple of important updates. One is that the FDA has granted amendments to several of the emergency use authorizations to extend the shelf life by 3 months of many of our at home antigen tests. So please don't throw away your antigen tests just yet. We'll want you to go ahead and make sure, because you probably got a 3 month extension. Some of them went from 12 months to 15 months of being valid. Some went from 9 months to 12 months. And so this includes the BinaxNow, it includes the iHealth, and the link to check the amendments is in the post. But mostly if you've got tests that have a June date, they are now going to be good until September. So please take a look at that before discarding tests unnecessarily, because the EUA has been extended and the tests have basically shown that they are still good for those 3 additional months. And of course, we're still wanting to keep them in a cool, dry place. Don't let them get hot or overheated. And in other interesting news, I mentioned that the FDA has given the approval to a breathalyzer test. This is very exciting. I'm very anxious to see when they're going to actually hit the streets. So what the FDA emergency use authorization states is that the company making these instruments can make 100 instruments per week, and each instrument can test 160 samples per day. So it's still a little bit unclear how these are going to be deployed and what is going to be the best use of these instruments. But I think we can all see that having something that you can just breathe into and 3 minutes later get a result could be very useful. And I'll be talking about some potential use cases in just a moment. The other thing that we're seeing being piloted in various settings is the dog sniffing, the COVID sniffing dogs. Apparently, beagles are the best at this, from what I can tell so far. We see that there is going to be a pilot. There's some piloting of this going on in multiple places. There's even some entertainment establishments, some bands that are using them. That their dog that travels around with them can sniff it out. And so there's in workplaces, some workplaces are actually using their resident dog to help sniff out COVID-19. So I think there'll be a lot of interesting potential uses for this. Probably also a lot of interesting legal questions about privacy and about what happens when we do detect it in certain venues. What are we going to do? Is this something that we're going to end up having in the airport? Some dogs sniffing out COVID, like we know that they're trained to sniff out other things. So pretty amazing. Fairly low cost. It does take months to train these dogs to do it, but I think it is another promising way that there may be the ability to do some screening that doesn't involve the swabbing and so forth. And so potential use cases would be to prevent super spreader events. So unfortunately, there was a recent super spreader event here in the Bay Area in San Mateo High School that had a prom indoors, and almost 100 of the young people tested positive for SARS-CoV-2. So this became a super spreader event, and this is really unfortunate. What is supposed to be a time of celebration and fun, and unfortunately a number of young people got sick. Not sure who else might have got sick, but about 100 cases from one event amounts to almost 1 in 6 of the attendees. And this is potentially 100 new chains of transmission. So this is highly concerning because we don't know who else outside of these young people then got it, what other household members may have caught it, what staff may have caught it. Don't know those details yet. I know that I've mentioned here that most of the counties have really moved away from contact tracing and are doing outbreak investigations, but a lot of that has been focused on congregate living settings. And so it's not clear that proms and other events like this, graduations, whether these are going to be included in contact tracing formally. I'm sure that this one should warrant an outbreak investigation, but I'm not sure what we can expect in terms of learning what the outcomes from this have been. If we have anybody with severe outcomes who caught it from one of the young people or the young people themselves, we know that based on so far what we're seeing around long COVID estimates, that out of those 100, we could expect maybe 10 to 30 of these young people will have prolonged symptoms or will have long COVID. Which we know can affect a number of different systems in the body. So this is all very concerning. It's not something we can take lightly. I was definitely disappointed to see that some of the spokespeople were saying things like it was worth it. We don't know if it's worth it until we know the complete toll. So I would really caution us against us having sort of this all or none attitude. I think we're very responsible for ensuring that events are safe for everyone involved, as well as all of the people that those individuals who attend the event are then going to come into contact with. And so I have a number of questions and suggestions around this, but I want to also point out a bit of upsetting news that I think was reported by the CDC recently around young people and causes of death. And this is something that is new that has happened as of 2020. So from 2019 to 2020, we had a sharp increase in the number of deaths among children and adolescents from firearms. And I realize this is not COVID related, but because it happened in 2020 and many things have happened in 2020, and because we are, of course, worried about the shortening life expectancy that we're seeing across most of the age groups right now, this is something that I felt was important to bring up. Not only were there over 45,000 firearm related deaths in the United States in the year of 2020, and that was a new peak, and that is for all ages. But I think it's also very important to note that firearm related injuries are now number one. They used to be number two. They were number two for many years for young people. So this means under 19. But they have now surpassed motor vehicle crashes and are now the leading cause of death. So firearm related injuries are now the leading cause of death among children and adolescents. That's ages up to 19 years of age. So the gap between those top two causes was kind of getting smaller year over year since 2015, and now tops the list. And this is frightening. This is unacceptable. And this was when COVID was just getting started. I'm going to read a quote from a piece in the New England Journal that was remarking upon this by some professionals out of the University of Michigan. And it says, it cannot be assumed that firearm related mortality will later revert to pre-pandemic levels. The increasing firearm related mortality reflects a longer term trend and shows that we continue to fail to protect our youth from a preventable cause of death. Generational investments are being made in the prevention of firearm violence, including new funding opportunities from the CDC and the National Institutes of Health, and funding for the prevention of community violence has been proposed in federal infrastructure legislation. This funding momentum must be maintained. I cannot agree with this more. Here in Oakland, we are certainly seeing increases in gun-related deaths, and this is a very disturbing trend, and we don't know what is going to be seen next for 21 and 22. We do know, though, that in 21 and 22, we are seeing an increased number of COVID-related deaths in our young people. So I'm saying all of this to say that the adults in the room need to take responsibility for all of the ways in which we have to protect our young people and prevent these avoidable causes of death for our young people. So I am certain that we know that we're going to see SARS-CoV-2 as one of the top 10 causes of death. It already is for most of the even the younger age groups. And I've reported on that many times here. And so these are all really troubling trends that I want us to be aware of and seeing what it is that we can do to mitigate them or reverse them. So, as we come back to looking at how we need to be responsible as adults for the exposures that our children are having, I've talked a lot of different times about schools, but now it is prom season and then graduation season. And so, we really need to take this seriously. We cannot just say, oh, it's worth it to get together. It's not all or none. We need to put mitigations in place. We need to have more outdoor events, eating and drinking. Certainly, we're fortunate in the Bay Area to have pretty good weather, and we should be taking advantage of that and having some of these events at least partially being outdoors, encouraging that the eating and drinking and things that need to happen without masks are happening outdoors, that the indoors that we're using is well ventilated, then we're not going to cause a super spreader event with what should be a celebratory event. We should be considering pre-event testing. Pre-event testing could have prevented much of the transmission that happened at this unfortunate prom event. And after the events, we should be encouraging attendees to stay away from vulnerable people, get tested afterwards just to be on the safe side. Increased mixing means increased risk of transmission. It is not over. We need to be careful. We could not throw all of our caution out of the window. And keeping in mind what I stated about counties having moved away from case investigation and contact tracing, I think advocating that these events have guest lists, that we be able to hold the event organizers accountable to contacting people on those event lists in the event that something like this occurs, so that we'll know what is going on and we can warn people in enough time so that they do not continue to spread it or spread it to those especially who could have a poor outcome. I also need to say a note about staff who are asked to attend and to work these events. Are we protecting them? Are we giving them N95 masks to make sure that they are protected? Those are the people who are likely at the greatest risk because they are usually mixing the most. And these may be our essential frontline workers who may be using public transportation, who may be exposing their family members, who may be at greater risk of having a poor outcome from SARS-CoV-2. So we cannot say, oh, it's time to go back to normal at the expense of those who are working and are being made vulnerable in the name of that normal. So making sure that we are protecting our most vulnerable and protecting those who are actually having to staff and work at these events. So it's one thing to say we're tired of this, we want to go back to normal. I get that. One of the reasons why this so-called back to normal is being promoted is because we supposedly have the tools. That means we have to use the tools. We have tests, we have masks, we know how to measure ventilation. We need to really demand these things. And as I've mentioned before, is there a way that we can actually grade our indoor venues as to the quality of the ventilation and the filtration inside, just like we have grades on the outside of restaurants about how they're doing with other safety measures? I think that we really need to move in this direction. We need to make sure that business owners and venues have support in order to upgrade their ventilation. But this is something that without universal masking and things of that nature, that this is really an important investment that we're going to have to make. So I'm going to keep mentioning that. And we know that with mask mandates being dropped on public transportation, again, what does the ventilation look like? How many air exchanges per hour do we have in our trains, in our airplanes, on our buses? These are very important, really critical pieces of information, not just for the riders, but for the staff, for the bus driver, for everyone who is going to be exposed to the public in this manner, and making sure that there is ample supply of high quality, high filtration masks available. And so could some COVID sniffing dogs could have been of use in this case? Could breathalyzer tests have been of use in this space? I think that these are exciting new developments, and we'll definitely be looking at how those can be implemented. But short of that, we have home tests, we have antigen tests, we have PCR tests, we have multiple ways that we can use the tools of testing prior to gathering. And I think it's up to all of us adults who are going to be attending these events, who may be part of organizing these events, that we advocate, that we implement these measures in order to protect all of us. And I'm going to say that this is especially important as we look to graduations. Graduations have unvaccinated babies who attend. They have our elders, others who may have underlying conditions that attend. And so I really hope that this event here that happened as a super spreader event is a wake up call. I already see that a neighboring high school is going to be piloting the dog sniffing with the California Department of Public Health. So I look forward to seeing what that yields and whether that can be an appropriate way of screening folks before they go in. But we really need to get it together, and we need to do it now, before we have a summer wave, before we have multi-generations packing into an auditorium for what should be a momentous occasion like a graduation. We do not want it to turn into tragedy for any of our families or individuals. So please, please be vigilant and speak up, because we have the tools. Let's use them. We know that outdoors is always going to be safer than indoors. And we know that a high filtration mask is going to be optimal when indoors, especially if you are one way masking. So, meaning if you might be the only person on that airplane or in that venue that has a mask on, a high filtration mask is going to be especially important. Shorter time indoors is always going to be safer than the longer time indoors. And if you are going to be in a small space, like in the car, please keep on a high filtration mask and open those windows. It makes a huge, huge difference. And to prevent the most severe and tragic outcomes of SARS-CoV-2, vaccination and booster are still remarkably effective at allowing you to survive, even if you do catch SARS-CoV-2. If you're over 50 years old and it's been more than 4 months since your booster, you are eligible for a second booster. And remember that we have several outpatient treatments for SARS-CoV-2, but you've got to do it in time. The oral treatments need to be started within 5 days, and the IV treatments need to be started within 7 days. So please, this means get tested, repeat the test if you still have symptoms, and reach out to your primary care doctor so that you can get treated, especially if you're in a high risk group and have symptoms. And if you don't have a primary care provider, please get one. Please, let's make sure to eat a balanced diet, manage your stress, take a multivitamin, consider additional vitamin D supplementation, manage your stress, and get a good night's sleep. This concludes today's People's Health Briefing, and we look forward to seeing you next Tuesday at 10 a.m. See you then.